Have you been recommended to go to a women's health pelvic floor physical therapist, or maybe even just a women's health physical therapist, and you're wondering what is it that they actually do and can they actually help me with my problem? Well, then today's video is for you. Today we're talking about different issues that really do better with a pelvic floor physical therapist or a women's health focused physical therapist. The reason why is that women have different situations and different hormones and different stages of life, how things are affecting them differently than men do. And if you see a physical therapist who is focused on seeing both groups of people, it can be a little bit more difficult because they probably are not quite as familiar with what's going on with a woman's body as she's going through the different phases of life. So there's a ton of research coming out recently that we're really starting to understand that the hormonal changes we go through during our journey through life really do affect everything from our exercise capabilities to weight gaining to where the weight sits on our body. The hormones can affect our gut, and we all, I hope by now, know how important gut health is in regards to your brain and long-term issues with your brain. These things are all connected. We always talk about that around here at Physical Therapy for Everybody. It's really important to see someone who understands specifically how those things are connected in your body. We're going to talk about a couple of specific diagnoses that I definitely recommend you seeing a women's health specialist or a pelvic floor physical therapist to be able to treat. The first one that most women can figure out is pregnancy. So when you're pregnant, obviously hormonal changes are happening. Your body is changing as you go along. We see an increased incidence of low back pain, pelvic pain, side joint pain, hip pain, difficulty walking, all kinds of things because our bodies are changing as we go through pregnancy. It's really helpful to see someone who specifically understands what's going on with your body during that entire process as well as during your recovery. So they commonly say that you are pregnant for 10 months and it takes your body 10 months to recover. I would definitely agree with that. You are not going to be at 100% before those 10 months. Now, you'll see a lot of improvement early on, and that's fantastic, but we really want to allow your body that full time to heal so that you can get back to 100%, which means I don't usually recommend that people go back to things like high level activities like running, jumping, squatting, lifting, things like that until 10 months. But I definitely don't recommend it if you are not seeing a women's health or pelvic floor specialist, because you need to have someone who is looking specifically at your body to make sure that the pelvic floor is strong enough, that your abs are back and board. We don't want to have a long-term diastasis recti that's going on. We want to make sure that you are getting the care you need specifically for your body. I will tell you that when you go to your OBGYN appointment at 6 weeks, they'll probably tell you, yep, you're clear to go back to do anything you like. I was told that when I went to my OBGYN appointment, and friends, let me tell you, that is not actually a true and accurate statement, because then I decided to go running because why not? I was cleared by my doctor, and 20 years later at this point, which gives you a little idea of how old I really am, 20 years later, I am now dealing with the repercussions of that decision, because at the time I was not a women's health specialist and I didn't know really that much about the pelvic floor. We didn't learn about it in PT school, and so we learned about it. We learned that it was there, but we didn't really learn about the importance of it. So that's why it's so critical to see someone who understands the importance of it as you're recovering from pregnancy, because we don't want to see you 20, 30, 40 years down the line having problems because you got back to running too quickly, or because your hips never came back into alignment, or you never strengthened them, or you kept that diastasis recti. These are the things that we want to deal with now so you don't have to deal with them later. Now, what we're finding is many women in their 40s, 50s, and 60s today are being diagnosed with osteoporosis. And there's a lot of concerns and questions about what you should actually do. This is complicated because a lot of the current research that we have on osteoporosis was done predominantly on males. We're now starting to get more and more research coming out on females, but it's really important to understand the distinction and how your hormones and how that changes throughout life also affects osteoporosis. So in this case, you definitely want to be working with your doctor to see if there's any medication that is appropriate for you, and also to make sure that you're keeping up on your scans and things regularly as your doctor recommends, because we definitely want to keep a close eye on your osteoporosis and see how things are changing. And that's why we want to see a women's health specialist, because they are going to be trained in what is going on currently with your hormonal system, as well as the medication that you're taking, how to maximize that through exercise. So again, we want to make sure that all of the joints are moving correctly, all of the muscles are moving correctly, that your body's able to move correctly to do the exercises that you need to do to help keep you as strong as possible. When you are diagnosed with osteoporosis, of course, we want to work on things like balance and your core, but we have to be really careful in how we do that because, we have osteoporosis, so we just need to be a little bit more gentle. So going to some place to get some fall prevention exercises or work on some strengthening may not be the best idea for you, because you want to make sure that your body's moving correctly before you integrate any new exercises into your program. You may have also heard about the female athlete triad. So this includes how much energy you have available, the bone mineral density, as well as your menstrual cycle. Many women, as they become more competitive or spend more time even doing their exercise, find that they struggle with maintaining a normal menstrual cycle. Well, if that's true for you, then that's going to throw off your hormones. If you're throwing off your hormones, that affects your bone mineral density, as well as affecting the rest of your body. Everything is connected. If you don't have a normal menstrual cycle that's supposed to be every 28 days, then that's going to change your gut health. It's going to change how your hormones are interacting with your body, and it changes a lot of other things, which eventually affects your energy. If you're someone who works out regularly, so 4 to 6 days per week, and definitely if you tend to do that higher intensity exercise or more endurance type of exercise, and you find yourself chronically tired, this may be something that's affecting you. So it's important to see a women's health physical therapist, because they can look at the whole big picture and understand, if you come in, maybe you have an injury from your activity, but it's really due to this female athlete triad. So you have knee pain, but it's really because you've been running on the concrete for a long period of time and you're constantly fatigued, so the muscles are just not able to have the energy that they need. This is a big picture thing that we need to look at. Obviously, we need to deal with the knee pain. We need to deal with the hip strength. Obviously, all of that needs to be done. But we need to look at how are the hormones, how is the pelvic floor behaving, and do you have enough protein and the nutrition and hydration that you need to be able to do that activity for a long period of time. This is the difference between going to a women's health specialist as opposed to just a regular physical therapist, because they're going to look at this whole bigger picture. Everybody changes throughout their life, and it's important to look at everybody as an individual. The activities you may have been able to tolerate easily when you're younger may not be as easily tolerated as you're older, and it's important to look at the reasons why. And if the women's health specialist cannot help you figure that out, then to make an appropriate referral to someone who can do that workup and figure out what is going on. So maybe that's sending you to a naturopath or a nutritionist or an acupuncturist who's going to be able to work on things from the inside. That is the one thing about women's health specialists. We can only work basically on the outside, but we can't deal with what's going on inside, what you're putting in your mouth, your hydration levels, and obviously making sure that you have proper nutrition. But we can definitely help you find the person who will be able to get you there. And having someone who has a wide network, a really wide net to cast to help you find the person that you're looking for is super, super helpful. So I know when I have patients who are struggling with nutrition issues, I have different options that I can present to them of different professionals who offer different services, and then I can ask them which one sounds like the best for you, and then they can make that decision on what it is that they're looking for their health. So when should you consult with a women's health specialist? Well, the first thing I want to say is if you are limiting your social interactions due to whatever the problem is that you're having, either you're concerned about falls with osteoporosis, maybe you have some leakage after pregnancy, or maybe you're just exhausted from the day-to-day life, I would definitely recommend seeking out a women's health specialist to help get everything back in balance. If you're concerned about being able to exercise, or you feel like every time you try to exercise you hurt yourself, you're constantly having injuries, or again that chronic fatigue that just seems to keep you from being able to get back to where you were, then I definitely recommend seeing a women's health specialist to see if where you were is realistic to be at this time, or do we need to build a ramp to help get you back to where you were before. Or do we need to add something else into the mix? Maybe sending you to see a naturopath because we're worried about what your iron levels are. Things like that. How do we build this team that's going to help you to be able to do what you want to do? And if you are struggling with anything that is impacting your quality of life or your ability to be able to do what you want to do, if it's something like low back pain and picking up your child, if it's something like being able to run a marathon, which is important for you to get back to, whatever it is that you're struggling with, then I definitely would encourage you to seek a women's health physical therapist, because they're going to be able, again, to look at that whole big picture. And really, that's what you need as a woman, because our hormones, our gut, our pelvic floor, our breathing, all of these things are related, and it is really important to understand how it all works together in your particular situation, because every body is different. All right, I hope you found that helpful. If you did, definitely click on that subscribe button, and if you'd like to watch another video, I'd recommend that one right over there. Have a great day, everyone. Bye.